LENSAR has been working to develop a treatment for presbyopia using a laser in the lens solution since 2004. The natural crystalline lens changes shape when we are young to allow vision to focus near for reading or quite near for threading a needle. Professor Adrian Glasser, our consultant, has shown the loss of flexibility in the lens itself is responsible for 100% of the loss in accommodation amplitude with age. Mary Ann Croft and others have shown the ciliary muscles are still operational in presbyopes. This knowledge forms the basis for our work. We began by creating a finite element model, the most complex ever done for the crystalline lens, using the 30 years of research by our consultant Jerome Cusack. Our lens model is shown to be quite similar to real lenses photographed by Professor Cusack. Our model shows the importance of curved fibers to allow a mostly rigid structure to be flexible, aiding accommodation. Our model follows the natural suture development pattern Cusack shows in real lenses. We configured zonular connections and model forces pulling on the lens to disaccommodate the lens shape. We learned that outward equatorial zonular forces translate to inward polar forces to compress the lens. We showed that simulated laser treatments both increased the compression of the lens for the same zonular forces, but also could provide an optical power variation as well. This effect is highly algorithm dependent. We also conducted tissue experiments using the Glasser stretcher device. We showed, as many have, that young lenses have large optical changes as they are stretched, and older ones change much less until zero optical change is found over age 50. We showed that certain algorithms were effective in increasing the thickness change for the same spin rate, but other did not. We tested laser algorithms designed to increase and decrease refractive power in the lens. We showed significant increase and decrease in power compared to untreated controls for cultured porcine lenses. Professor Cusack showed that the LENSAR laser, pulse width, energy, and spot size produced clean cuts in the human lens with no collateral damage on the microscale. We conducted experiments in human lenses showing clean effective cutting at the macro scale. We improved on compression testing of lenses that Glasser and Campbell had shown in 1988 and 1989. We measured absolute forces, not relative, and assured that our testing was non-destructive. This work set a standard for how much softening might be required to achieve a certain accommodation level. A factor of 2.5 is estimated to achieve a 3 diopter improvement for a 65-year-old lens. We showed highly reliable and repeatable lens softening in aged human donor lenses compared to the paired donor lens control. We achieved a factor of 2.5x in softening. We conducted live rabbit studies in 2006 and showed no cataract formation at 3 months in this animal model, known to be highly susceptible to cataracts from trauma. We also showed the optical quality of the treated lenses were not degraded compared to untreated controls. We conducted live monkey studies in 2007 at the University of Wisconsin with Dr. Paul Kaufman as principal investigator. These studies have shown the surgery to be well tolerated and no cataract formation out to 3 years of study. LENSAR's early work in live animals jump-started our efforts to perfect our measurement technology to guide the laser automatically. LENSAR has direct experience in flat, curved, and water bath interface devices. Because of our early feasibility work in animals, LENSAR was the first in the world to conduct human clinical studies for laser treatment of the crystalline lens for presbyopia. The work has been very conservative in treatment scope and is treating only low-grade cataract patients thus far. Although the treatments have been conservative and on non-clear lens patients, LENSAR is encouraged about the preliminary results. Additional algorithms with more substantial treatment patterns will be tried in the future. One laser treatment algorithm that spares both the visual axis and equator is shown from our human clinical trials in the Philippines, with Harvey Wee as principal investigator. Previously, Dr. Ramon Urano performed the first laser in the lens treatment of presbyopia in the world in Mexico City using the LENSAR laser system.